Have you ever wondered if the physical therapist you are working with is any good? Because just like any job in this world, some people are simply awesome at their jobs and others, not so much. And I'm willing to guess most of you would prefer to work with an awesome physical therapist over a bad one. We are dealing with your health and well-being after all. And while it takes years of schooling to become a physical therapist, you don't need to know much about your body or the profession to spot the good therapists from the bad ones. You just need to know what to look for. So in this video, I'll be covering 4 signs you've found a great physical therapist. A great physical therapist stands out from the start by engaging in meaningful discussions about your concerns and condition. They use open-ended questions, allowing you to share your experiences freely. This creates a conversational atmosphere where you feel heard and understood. By listening more and speaking less, they gain a comprehensive understanding of how your condition impacts your life. And this line of questioning will take up a good portion of the examination too, as it is incredibly valuable to providing you great care. I would argue that this conversation is much more important than the hands-on part for most patients, which may sound surprising considering we are physical therapists after all. This discussion can take anywhere from 15 to 20 minutes. For more complex cases, sometimes talking for over a half an hour may be needed. This allows for a much more holistic understanding of your specific needs, which is key to tailoring an effective treatment plan. On the other hand, a less effective therapist might bypass this crucial conversation, opting for a more direct and almost interrogation-like approach. Their questions are likely to be closed-ended, eliciting only yes or no responses from you. This shortcut overlooks the unique context of your situation, resulting in significantly shorter and less insightful line of questioning, often lasting only a couple of minutes. The next thing to look out for is how a physical therapist conducts their physical examination. Unlike many other medical professionals, a physical therapist's exam is much more lengthy and comprehensive when it comes to assessing physical function. This is because our job is not only to alleviate pain, but also to understand its underlying cause. This approach allows for the development of targeted treatment strategies geared towards both resolution and prevention of recurring issues. Now, a skilled therapist thoroughly examines not only the area of discomfort, but also adjacent body regions. For instance, if you present with knee pain, the clinician should not just focus on the knee. They should also assess the functionality of surrounding joints and muscles, including the back, hip, ankle, and foot. Recognizing that our bodies operate as an interconnected kinetic chain, they should explore how dysfunctions in one area may manifest as pain elsewhere. It's pretty amazing how addressing seemingly unrelated areas can alleviate discomfort without even touching the site of pain at times. This comprehensive approach provides insight into your body's functioning as a unified system, and great therapists will be able to explain to you the intricate relationship between different body parts. But in contrast, a less proficient therapist may excessively fixate on the symptomatic area while neglecting the broader context of your body. While they might offer a superficial explanation for your pain, their understanding of its root causes is likely limited. And as a result, their treatment approach may provide temporary relief, but long-term resolution or prevention of recurrence of symptoms may be limited. Another unmistakable indicator of a top-notch therapist is their familiarity with the latest evidence-based practices. The evolution of treatments over the years is truly remarkable. Consider the case of ultrasound therapy. Remember that wand-like device with cold gel that therapists used to spread all over your body? Well, there is mountains of evidence that shows that this treatment is basically useless. However, some therapists continue to utilize it in their clinic, either due to a lack of awareness about current evidence or resistance to change. And while the absence of ultrasound use doesn't guarantee your therapist actually knows what they're doing, it does serve as an example of how practice patterns have changed in just a few decades. So you want someone that's up to date with current evidence. Now, an easy way for you to assess a therapist's commitment to evidence-based practice is to simply ask them. Just say, what is the evidence supporting management of my condition? If you have a great therapist, they won't even skip a beat. You may even see them light up as they get to nerd out with you about the science behind your body. But not only should they be able to cite evidence, they should also be able to explain it in a very understandable way. However, if your therapist consistently offers brief and superficial explanations that lacks depth or clarity, or if they struggle to provide coherent answers, it's very likely they're not up to date with evidence. Another tactic that some healthcare providers utilize to mask their lack of knowledge is the excessive use of medical jargon. It's a way for them to hide their ignorance by hitting you with complex terminology in hopes you don't ask follow-up questions. Now, after the examination portion is over, it is now time for the therapist to educate you. This is arguably the single most important job of a physical therapist, educating you as to everything you need to know about your body, how it works, and what it needs to keep moving. It's the very reason this is our catchphrase. Great physical therapists highly value providing you with knowledge and skills needed for you to take an active role in managing your condition and preventing future injuries. They'll educate you about your diagnosis, explain the rationale behind your treatment plan, and teach you strategies for self-care and injury prevention. The ultimate goal is to provide you with a sense of empowerment and autonomy, helping you to build confidence in your abilities to make informed decisions about your health. You should leave the clinic with a clear picture of what you're dealing with and what is needed to make it better. On the flip side, if you leave the clinic not knowing what's going on or are more confused than when you walked in, you're probably dealing with a less than stellar therapist. After all, your well-being is why you see a physical therapist, and finding a therapist who is invested in your care and effectively sets you up for success is key to your journey towards optimal health and function. What are your thoughts? Did you notice any of these behaviors in your interactions with a physical therapist? Share your stories with me in the comments below. Your insights could help others navigate their own journey to finding the right therapist. Well, I hope you enjoyed this episode of PhysioShow. Make sure to give this video a like and subscribe to the channel to learn more about your body, how it works, and what it needs to keep moving.